Next, so the recording has already started. Just to let you know that we are recording the session for wider benefit. Let me hand over to my colleague Mamoon, who's going to really do the introduction, tell you about some housekeeping, and give you some context as to why we're having the session before we go into our panel discussion. Mamoon, over to you.
Hi, very good morning, everyone. My name is Mamoon Khan. I work as the program manager at the Asian Resource Center of Croydon. Thank you once again for joining us this morning for this very important topic. So as Ima said, I will just briefly take you through a few housekeeping just for us to have a productive meeting this morning. So just to let everyone know that this session is being recorded and will be uploaded to our website, social media accounts. If anyone's not comfortable being on video, feel free to switch your video off. That's not an issue at all. Please ensure that you use your real name on your Zoom ID so that we can identify who you are. You can use the chat facility to post any comments, questions related to the topic. And we have expert panelists that will be able to answer those questions for you. Please do not post any links or images on the chat. This is to ensure the online safety for everyone. Everyone is on mute as you come into the meeting. However, you will have an opportunity to ask any questions at the end. We aim to finish around 11:30, so it's only a very short session, no more than 1 hour. So we'll try to be prompt with the timings. So let's have a productive and respectful conversations, knowing that there will be diverse views on this topic. Right, so in terms of context, so just to let everyone know that this session is being delivered in partnership with NHS England. Some of you would have noticed that over the past few months, ARCC has been running a series of campaigns, workshops, and outreach sessions on MMR, flu, and COVID vaccination. This has been primarily done within a community setting and more specifically targeted towards the different faith communities. So far, we have delivered 3 workshops with different faith communities, one at a mosque, one at a temple, and one at a church. We've done 4 outreach sessions at different community events. We've done 10 online campaigns around winter wellness, flu, COVID, and MMR. And so far, we have reached over 5,000 individuals through the various campaigns that we've done. And this webinar is really our final session with an expert panel to really go through this topic and try and have a deeper discussion on some of the key points. And these are just a few flyers of the various sessions that we've had over the last few months on the winter wellness campaign, cold and flu, MMR. And these are just a few pictures from the different sessions that we've had. As you can see, this one here at the temple, this was at St. Matthew's Church, and this was at a mosque. So before I pass over to Ima to continue with the panel discussions, there is an important message from the UK Health Security Agency that I'd like to play. It's only a very short message, it's 1 minute. So if you could kindly listen to this, and then I'll hand over to Ima to continue with the rest of the meeting.
London is currently at a very high risk of a measles outbreak, with cases on the rise, and our modelling suggests that the city could soon see an outbreak with tens of thousands of cases. Measles is highly infectious, and it can lead to serious complications and even death. Thankfully, the measles vaccine, the MMR, is highly effective and safe. But MMR uptake is now at the lowest it has been in a decade, and we're starting to see cases of measles rise across the UK. Most of those cases are in London, and in some boroughs, vaccine rates are as low as 65% for the first dose. That number might not seem dramatic, but in reality, it means a lot of people are unprotected and at risk. In fact, our modelling suggests that an outbreak of between 40,000 to 160,000 cases could occur in London. Catching up and vaccinating our children when they are due can help prevent outbreaks. It's never too late to catch up, and that goes for adults too. So if you or your family have missed 1 or 2 doses, contact your GP as soon as possible. If you're due to travel overseas soon, it's also important to have the vaccine, as we're seeing measles outbreaks in many countries around the world. London is currently at a very high risk of a measles.
Excuse me. You're on mute if you can come off mute.
Thanks very much. I mean, I was just saying, if you hadn't heard it once, we were just about to play it twice. So you've just heard it, very high level figures from the UK Health Security Agency about what could potentially happen. But we've got as we said, an expert panel with us today to discuss a little bit more. If you can go on to the next slide for me, I mean. Thank you. So I wanted to give you a quick introduction to our panel and what they will be talking about today. So there's two primary questions we're really looking at, which I will go into in a little bit. But actually, we've got a panel of Gill, Biju, who's the CEO of the Croydon GP Collaborative. We've got Dr. Hana Patel, who's a local GP and also a trustee of the Asian Resource Centre of Croydon. We've got Dr. James Moore, who's a public health consultant. And we've also got Christina Bushra, who's a lead immunisation pharmacist for South West London. And we've got Mikhaila Brentnall, who's a communication and publications manager for NHS England. Can I just say a very warm welcome and a thank you to our panelists for joining us at it was pretty late notice, I know, but it just shows the importance of getting together, because you all joined us at such late notice. The reason why we've kept this session short is because we know that we've done a series of sessions over a couple of months now, so we've hopefully done a good lead-in to this particular webinar. And I didn't want to spend too much time talking about ARCC and ARCC's work, because we really want to hear from the experts today. As Mamoon said, you can join in the conversation through posting your questions on the chat function, and we will try and fit in some time at the end for our panelists to address those questions. But if we can go straight into it, I would like to invite, first of all, Dr. Hana Patel, because you're our resident GP. If you could just talk a little bit, first of all, introduce yourself, what you do, and talk a little bit, Hannah, around the GP perspective around vaccination issues in general, please.
Hello, everyone. Good morning. Thank you for giving up your time and coming to this informative session that the ARCC has put on. Apologies to my other colleagues on the panel, and thank you for letting me go first. So as Imma kindly shared, I'm a local GP who grew up in Thornton Heath, went to school locally in Croydon, and has come back to live in Croydon again. So I'm really happy to be working in the area and sharing my expertise and I guess real world view of what I'm seeing with regards to patients and vaccinations. And I'm hoping to share some of that with you today and add with my other expert colleagues who are on the panel.
Fantastic. Hannah, would you mind just giving us sort of a minute on what you see is the issue generally with vaccinations and what GPs are sort of seeing in surgeries at the moment?
Yes, of course. So I think the most common myth, and the one that is most widely publicized and parents always ask me about, is it true that the MMR causes autism? And sadly, there is a lot of misinformation about vaccines, even more so now that we have social media platforms to share people's thoughts and ideas. And I think one of the most notorious claims is that the MMR vaccine causes autism in children. And it's had such profound and significant effects and affecting people's choices, so much so that I was looking at some data from UNICEF, and they published some data that said only 1 in 5 children who was born in 2019 in Montenegro had the MMR vaccine, because of all of this misinformation that was going around, which is really significant. And I suppose that sort of adds to why we're seeing a lack of parents wanting their children to have the vaccines now. And just to maybe touch a little bit about where this misinformation came from, and when you think about the impact of what Dr. Andrew Wakefield, who has been struck off from the GMC and is no longer recognised as a doctor in England. He was an English gastroenterologist who in the 1990s was involved in giving his opinion on a study that was carried out. And I think he reviewed, it was only 12 patients. And he said that a certain vaccine led to changes in people's bowels and intestines. And this led to an increased risk of getting certain toxins from food and the environment. And that was his theory from reviewing only 12 patients. And I guess it's the power of misinformation that it's had such profound effects on, children today who sadly are being diagnosed with measles and mumps and rubella. And I know that Dr. Moore is going to be talking a little bit more about that in his role as a public health consultant later on. But yes, I think autism is the most common reason why parents refuse or prefer not to have their children to be vaccinated.
Thank you. Thank you very much for that, Dr. Hana, and a really powerful message about misinformation and how tiny study can actually lead to quite profound impact on the take-up of vaccinations. Let me ask you a question about pregnancy and rubella, because there's a myth around that as well. Or is it a myth? Is there any truth to it?
So I was doing some research before this session today, and I think there's a concern that if women are pregnant and they haven't got the vaccine for rubella or the MMR, that they should wait until they give birth to have the vaccine. So I don't know if it relates to that, or if it's whether it's for boys and girls, because there's this concern that only pregnant women are at risk of rubella, but actually boys and girls are offered the MMR vaccine. It's for everyone, and we usually give it to children in the immunisation schedule. This is another question that sometimes parents ask, when should my child have it? So you're normally offered it as part of our vaccinational schedule in England from the NHS when babies are 1 year old, which is their first dose, and then 3 years and 4 months, which is the second dose. And it's possible for parents, if they've missed either of these vaccines because of COVID, because of traveling, any reason at all, moving, parents are able to contact their surgery to ask for a missed dose.
Thank you very much for that clarity, Dr. Hana. It's really useful to know that it's for boys and girls. So if you were thinking that just your girls needs to have it done, everyone does. Thanks very much, Hannah. We'll move on to our second panelist now, who is Dr. James Moore from a public health consultant. So, Dr. Moore, if you could tell us just a little bit about background about yourself and talk a little bit about what the problem is from a public health perspective, and maybe a little bit of research around uptake. Thank you.
Yes, of course. Thank you very much. And as Amos very kindly said, a public health consultant working here in the Borough of Croydon Council. We very much deal with the health of the population, whereas my colleague Dr. Hannah will be dealing with the individuals. Measles is a great example of something where vaccination has made a huge difference over the years. And I'm just going to add a little bit of historical context, because I think it really drives the message around why the vaccination around MMR is important. And before 1961, there was limited, well, there wasn't a vaccine, and measles was extremely prevalent in the UK. We had almost 700,000 cases in England and Wales in 1955. And as we've introduced the single and then the trivalent vaccine over time, we've reduced that. And in the cases of measles, the problem is it's not just a disease of a runny nose or a rash. It was causing tens and almost hundreds of deaths every year, which, as we have a vaccine, is preventable. As we've introduced we initially did a single dose, and then they added a second dose, which increases the immunity and the amount of people who are covered by the vaccine. And as we've done that, we've managed to reduce the spread of measles in our communities. as the numbers of people who were vaccinated increased, we gradually got to a point where we introduced what we call herd immunity, which is where the susceptible population of individuals is small enough to prevent the spread of the disease in the community. So enough people are vaccinated in the community that actually a disease gets into one person, but it hasn't got anywhere else to go. We saw this recently in COVID, where we stayed at home, which stopped the spread, and then eventually we also used the vaccine there. And we were really successful about that for quite a period of time. And actually, in 2014, we managed to actually stop transmission of measles in the UK. So it wasn't an issue because we had enough people vaccinated. But due to multiple factors, including the impact of the sort of false beliefs in Andrew Wakefield's paper, we then found that we had sort of decreasing rates of MMR in our communities, which then, because we had people coming in from Europe and other countries, no fault of their own, we then had a large number of outbreaks because of our decreased immunity in the late 2000s. And this ultimately meant that we had measles circulating again. We haven't managed to eradicate it around the world, which is the problem. It's always out there. And it is highly infectious as well when we have it. Prior to the COVID pandemic, we saw just 79 cases in 2020. But what the biggest problem and why we're so keen about it today is we've already seen 650 cases in 2024. Which is much higher than anything in the years that have just gone by. And we link into, when we talk about herd immunity, we think about a 95% rate. So we want to get 95% of people immunised to stop the spread in the community and ensure that those who are vulnerable, who can't have the vaccination, are also protected. In Croydon, we are around 84.7% of our 2-year-olds who are vaccinated with 1 dose, and that rises up to almost 90% at 5 years. But at 5 years old, we've only got 77% of people who've had both doses. So this is why we're really trying to push to make sure people have the vaccine and get fully protected, and ultimately to stop the spread and avoid these quite serious complications that can occur.
Thank you. Thanks so much, Dr. James. Just wanted to ask you a question. You said it was really infectious. So we know the MMR, what the R. Maybe you can explain to people what the R is. We heard a lot of that during COVID. So the R rate for MMR is 15. Can you tell us how that compares against other diseases like COVID and flu? Because it's quite a lot higher, isn't it? Than
yes, certainly. And that's one of the reasons why when we talk about, I think my colleague Noel in the video from UK Health Security was saying about the potential of an outbreak of 40,000 to 100,000 people. And that's because we talk about this R number, which is a reproduction number. Apologies for people who got sick of it over COVID, but it is quite important when it comes to measles. When we talk about the R, we're talking about how many people somebody might infect if they have this disease in a completely susceptible population. So that means if people don't go and wait at home, sort of stay out of their community, people don't get vaccinated. And as Emma's mentioned, the R of measles is between 10 and 20. So if you didn't have vaccination and nobody was doing anything to prevent the spread, one person with measles could infect up to 20 individuals, which if those 20 individuals then go on to cause disease in another 20 individuals, very quickly, in just 2 generations, you've got 400 people with measles. And when it's a very serious disease, that can very quickly then spread through a community. If the R is less than 1, we think that actually it's not going to spread particularly well. If it equals 1 infection equals 1 new infection. But if it's more than 1, it creates a lot of that. And we can really reduce that R by ensuring that we get the vaccination. And the other thing is, if you do have it, it's also you're likely to be in contact with the UK Health Security Agency, and they will give advice to people who do have measles to stay at home for a certain period of time and make sure they don't then spread it around the rest of the community. In terms of comparisons with others, I believe COVID is around 1 to 1.2 at the moment, according to the government website on their most recent one on .gov. The common cold can be between about 2 and 3. So one person with a cold might infect 2 or 3 other people. And then seasonal influenza, which is a bit of a different one, which can sort of range between about 0.9 to 2.1. And now that's quite a large range for a disease we know quite a lot about, because actually flu does change each year. So it's not always the same virus, which is why it's also important to get your flu vaccine each year, because it does change slightly and you do need that additional protection. But thank you, Emma.
Thank you so much. Not going to let you go just yet. Just got one more thing. I just want to know from a public health perspective, are there any pockets of communities, are there any particular groups that we should be focusing our attention on in terms of sort of picking up more in vaccination rates? You've got on mute. Oh.
Sorry, could you just repeat the question? I was having a blind panic there.
No problem at all. I was just asking the question around, are there any particular groups of people or any communities that we should be focusing our attention on when it comes to sort of increasing the uptake of the vaccination?
So realistically, I don't want to single out any group, because ultimately across Croydon, we're not achieving the levels we need to in any of our communities. And the biggest problem is we know that if a community doesn't take the vaccine, they're more susceptible to the spread. So it's more likely to run through certain communities. But I wouldn't want to sort of say, oh, this community isn't doing quite as well, because actually across the whole patch, we need to be having that as a whole Croydon community, and not just Croydon, actually London, England, the UK, the world. We need to be pushing that up to all take responsibility, because we're all responsible for the threat and all responsible for the protection.
Dr. James Moore, thank you so much for your input, and we'll hear more from you when it comes to the solutions. If I could move on to our next panelist, who is Christina Bushra. She's the lead immunisations pharmacist for SWL, which is South West London. So Christina, if you could introduce yourself and tell us a little bit about what the vaccination actually does, what does it contain, and how does it work?
Thank you. Hi, everyone. Thank you for having me with you today. So I am the lead pharmacist for immunisations as part of South West London Integrated Care Board. And our team sort of support the general uptake of immunisations and just try and, it's a fairly new team. We're just trying supporting all the hospitals, GPs, community pharmacies across South West London that are delivering immunisations. We started off as a small team with COVID, and then it developed into flu, and then MMR and Mpox, and so on and so forth. So now we cover all immunisations in South West London. So I'll give you just a general background of vaccinations, and then we can go into MMR as a specific. So just, they are the most effective way to prevent against disease. And, we've managed to eradicate some diseases through vaccinations, as some of my colleagues have said earlier. And it's so important for people to take their vaccines, because now that, we've seen a reduction in uptake, we've had things like measles come back. So with regards to what the vaccination does, so the vaccines contain a small amount of the viruses, and that trains the body to build immunity and to create antibodies to fight the actual disease if we ever come in contact with the disease ever again. So it almost trains the body to fight it. And these vaccines, they produce long-term immunity. It can be very, very, very long-term, sometimes lifelong. With regards to the MMR vaccination, it is very important. So this protects against measles, mumps, and rubella. And as Dr. Patel said earlier, it's usually given at 1 year of age, and then another dose is given at 3 years and 4 months. However, there is an evergreen offer right now. So if anybody hasn't had their MMR vaccination, they can approach their GP, and then they can be vaccinated. It is very, very effective, and just to reinforce, it is very, very safe. So after 2 doses, you're looking at 99% of people that will be protected against measles and rubella, and about 88% of people that will be protected against mumps. I just wanted to reinforce the message that it is very safe, and that there is absolutely no link between autism and MMR. There's been lots and lots of evidence on this, and lots and lots of trials. In terms of, as with all vaccinations, as with all medicines, there might be some side effects, but maybe just a temperature or a general feeling of unwellness, but they usually subside within a few days. In terms of what it contains, so with MMR, it is a live vaccine that's been very, very, it's been weakened, and once you've been vaccinated, you cannot pass on anything or any of the, the contents of the vaccine. The main ingredient in there is generally water, and sometimes they contain, another ingredient such as an adjuvant that may just help the vaccine become more effective. But again, no harm to the recipient. There are two different MMR vaccines, which may be of interest. So there's one called MMR Vax Pro, which contains gelatin, and another one called Priorix, which does not contain gelatin. And I think that might be of use for religious or dietary requirements. So you can ask for the non-gelatin containing vaccine. And if that's relevant. The vaccine also doesn't contain any mercury, which is also known as thiomersal, which other people also have concern with. And I believe that's me. I think I've covered it all.
Thank you so much. I do have a couple of questions for you. So one of them, I know you said it's a very safe vaccine to have, but are there any sort of common side effects and any harmful reactions? And I guess some people might think a home remedy would work just as well. Surely home remedy is not going to be as good as taking 2 doses of the vaccination, will it?
No. No, because we're actually introducing these viruses in their very, very weakened form into the body. So we're training our body to almost have the ammunition. So if those viruses are introduced again, our body knows how to target them. And this is the only way against MMR, I'm afraid. So the body can actually build its immunity against it. In terms of side effects, they are very, very mild, maybe a sore arm, maybe a bit of a fever, just a general feeling of unwellness. But again, it shouldn't take long. Some people may not get any side effects at all. In terms of long-term adverse effects, none that I'm aware of. I think it's also important to know that these vaccines go through years and years of clinical trials before being introduced. And even after being introduced, it still goes through ongoing monitoring. So the MHRA, which is the Medicines Health and Regulatory Agency, they do continuous checks, and they ask us to report any adverse effects or any side effects. So even if things come up, they're still aware. So it's not only the pre-market checks, but also a lifelong check on the vaccine. So rest assured, very safe, no long-term effects. And if there are any side effects, they're very, very mild and won't last very long.
Thank you. And I'm not sure if you're going to be able to answer this question, but and other panelists might be able to come in here, but it's the holy month of Ramadan. I wanted to say Ramadan Kareem to everybody who's fasting and celebrating the holy month. Can people take the vaccination during Ramadan? Will it affect their fast, or will it make them feel ill if they take it?
Just to reinforce Ramadan Kareem to anybody who's celebrating. So my understanding is that it shouldn't affect the fast during Ramadan. It is injected into the muscle, and so that it doesn't give the body any nutrition. However, I always say perhaps just check with your religious leader before going ahead with your vaccination. And if it's felt unsuitable, then perhaps just use this time to book your vaccination and then have the vaccine after the fast is over.
Fantastic. Thank you very, very much, Christina, for that. And we'll talk to you more during the solutions. If I move on to our next panelist, I know there are people still coming into the room at the moment. So it's Mikhaila Brentnall. So she's the Communications and Publications Manager for NHS England. Thank you for joining us, Mikhaila. And I just wanted to know if you could give us a little bit more about the approach that public health has taken to vaccination campaigns, and a little bit about the rationale to that approach.
Sure. Thanks for having me this morning. Yeah, I'm Mikhaila Brentnall. I work for NHS England as a communications manager. So it's my job to share information about vaccines for particular working with routine vaccinations for children. At the moment, we have seen a decline in the uptake of vaccinations over the last 10 years. And we're currently have launched what we're calling a call recall for all those who have missed their MMR vaccine, either their first dose or their second dose. So they're completely vaccinated or partially vaccinated and at risk of catching measles. We are contacting the parents of children under the age of 16, those over the age of 1 to 16, and asking them to check their child's immunisation status for MMR. And if they've missed any doses, they can contact their GP to catch up at any time to get their child fully vaccinated. We're also contacting in the London area people from the age of 17 to 25 to ask them if they can check their immunisation status, just to check whether or not they've had their both doses of the MMR vaccine. And if they haven't, again, to contact their GP and catch up any missed doses to fully protect them against measles, which we are seeing the outbreak of in certain areas in England at the moment. Another option for children who are out of school age is that they can receive the vaccine during school through the school age immunisation service. This is a service that's been provided through throughout London at the moment as an enhanced service because we are seeing these levels of measles. So if you've been contacted by your school age immunisation service for your child to catch up, that can be done within school. There's also some community clinics that are available that you can take your child to catch up there as well. If you've missed that communication, there is a website I can drop in the chat, or if you wouldn't mind dropping into the chat, where you can contact your local school age immunisation service to give permission for that to happen either in school or at a clinic. I think that's where we are at the moment.
I went on mute there. Thanks so much, Mikhaila. Just a question for you. In terms of older people who might not have had the vaccination, I mean, is there an assumption that they'd already be, natural immunity built up? And why aren't we pushing more for older people? If we're talking about herd immunity, then we need a good section of the community to have been vaccinated, and some older people may not have been vaccinated. And also a question around migrant communities who've come in after that age where vaccinations were happening in school. Perhaps can you talk a little bit about that situation for us?
Yeah, of course. We are targeting the younger ones usually because they are more vulnerable in terms of getting serious illnesses. But the MMR vaccine offer is available for all ages, and we recommend everybody to check their vaccination status to make sure that they are fully protected for measles. If you were born before the MMR vaccine was launched, or an age where the MMR vaccine was launched, you may have had the single measles vaccine, which means you may be fully protected with the measles vaccine. But we do recommend for everybody, if you're unsure of your vaccination status, to contact your GP just to check. And if you have missed any doses, you can catch up at any time.
Fantastic. Thank you very much, Mikhaila. So I'll move on to our final panelist, who is Gill Biju. Now, I thought you'd be a really interesting person to call, and that's why I called upon you so late in the day, Gill, because I was thinking that we need to think a little bit about solutions, and every part of the system is affected by this. Everyone has a role to play. I wanted to know if you could tell us, firstly, a little bit about yourself and a bit about the GP Collaborative, where you are a CEO, and perhaps tell us a little bit about perhaps a different way of working, maybe, to ensure integrated work is happening.
Yeah, hi, thank you everybody, and thank you, Emma. And yeah, it's really, really good to be here. I've also got, I won't introduce Tori to come on because I'm mindful of time, but I've got Tori Edwards with me. So I'm Gill Biju, I'm the CEO of Croydon GP Collaborative. Tori and I work together in Croydon, and we represent all of the practices in Croydon. So when the collaborative was set up, maybe 2000, I should know this, 2016, 15, it was formed from all the practices in Croydon who wanted to come together to work collaboratively and to do things at scale. So this is my role, and it's really here today to talk to you about how we can work better with our partners. So that's with the council, the hospital, the commissioners, the mental health trust. And for me, for this, it's about getting the information to patients, residents of Croydon in the way that they feel trusted. I'm a mum myself. I've lived in Croydon about 25 years, and I'm proud to be the CEO of Croydon GP Collaborative. Everything we do is putting the patients and residents at the heart of all our services. We understand the challenges that practices are facing at the minute. It's quite difficult to get through sometimes. They've been inundated. Things have changed since COVID. So what we try to do is look at things a little bit innovatively and say, right, what is the problem? There is clearly a problem, as the previous speakers have identified, about vaccinations in Croydon, but nationally as well. So we look at it as an opportunity and say, okay, we know some work needs to be done. How can we do things differently? And as a mom in early 2000s, when I had to make that difficult decision, do I listen to the media or do I go down the route and get them vaccinated? It's a really tough decision, isn't it, that we have to make. So we reached out to IMA and the Asian Resource Centre and said, look, how do we do things differently? We know public health is sending out comms. We know practices as part of their core contract have to contact practices, but it's not clearly working, is it? What are the gaps? What can we do differently? So we're in a fortunate position where we can work innovatively. The collaborative is about working collaboratively and pulling together resources and looking at the population. So for example, it would be great to build on all the previous work that the Asian Resource Centre have done and the webinars and looked at the myths and looked at the information that's out there and get the feeling of what actually is wanted from the population. And ideally, if we know there's a specific community or it's open to absolutely everybody, but is there a different way that we could be delivering immunisation? So, at a particular gathering, could it be that we do a pop-up vaccination centre? If it's maybe delivered in the place where our community feels it's surrounded by people who they trust, they've got access to the right information, is that something that we could be hosting an event there? Or because we've got access to all the GP systems in Croydon, we could be saying, right, okay, maybe not now, but you can bring your child or you could bring yourself, depending on your own personal vaccination status, to one of our clinics. We could host some clinics. So really that's what we're here to do, and just trying to pull everything together, because it's not enough just for us to say, right, well, we know our practices have tried, they've contacted everybody and it's still not working. We don't want to actually put people off by just repeating that and saying, right, on behalf of all the practices, we're going to redo what everybody's tried already, because we don't want to put people off either, but equally we want to give everybody as many opportunities as possible to get vaccinated. So yeah, so we really actually welcome your views on how we can do things a little bit differently. We're happy to be present at some of the at the gatherings that you might have, some special events we could host, we could do pop-up clinics, as I've said. So really that's what we're about. So I'm really here to just get your feedback really in your steer as to how we can do things differently.
Fantastic. Thanks so much, Gill. And actually, let me ask our members of the public who've joined us. So Gill's just spoken about a different approach where community groups and GPs can come together, where the GP collaborative can perhaps come into the community and offer vaccinations after an awareness raising session. Is that something the community thinks is a good idea? Because it has to be a co-produced and a collaborative approach, doesn't it, Gill? It's got to be something that the community is comfortable with because for too long people have been uncomfortable with some of the approaches, and that's resulted in the lack of take up. So just give me a thumbs up if you think that if we introduced and we work closely with the GP collaborative by trying to bring sort of vaccinations closer to the community settings and sessions, give us a thumbs up and we'll know if we've, you know, if it's a good idea. I can see some thumbs coming up already, so which is good. And if you don't know where the thumbs up button is, if you go to your reaction, there's a little happy face on there with reactions. You can put your thumbs up there. But let me continue talking to Gill in the meantime. You can continue putting your thumbs up or down if you don't think it's a good idea. So Gill, I think, you know, we've established that there are you know, ways of us working together. Actually, let me bring everyone into this conversation now. We're going to go a little bit more sofa style and open it up to all of our panelists together. Let's talk about some solutions. We talked about different parts of the problem and different specialists that you bring and different issues you identify. My question is, what is the solution then? What can we do now that we've identified there are issues throughout? So anyone to go first, who'd like to go first in trying to give us a solution of what needs to be done? I mean, we could really think more about how to increase the take-up of the vaccination, and also about, you know, increasing confidence within communities. I had Dr. James Moore go first, and then Dr. Hana Patel, please.
Thank you very much. And I'm not necessarily going to give the solutions, but I'm going to just highlight, I think, that it's not just a single one thing fits all, because actually around vaccinations, there's several different areas we need to look at. You've got the system, so where are we delivering? How did we do it over COVID? Who hasn't had a chance when maybe a vaccination program stopped or there's not availability? You've got the community. How's the community work? How does the community interact both with the healthcare system and themselves? You've also got the individual. And at the individual level, there's so many different factors that will influence one person's choice or ability to get the vaccination. And I think that goes into three C's: your confidence, your complacency, or your convenience. Are you confident that you can get it? Do you feel you need to get it? And actually, can you get it? And Gill's given a great example of having a vaccination available at an event you're going to, whether that's going to your local faith location, or whether it's going to a community event. Having the ability to be there and get the vaccination, we know works, and we know allows people who do not have the time in the day physically go and do it to access vaccinations. So there's a starter from myself.
Thank you very much. And let's hear Dr. Hannah's perspective.
Thank you, Emma. Yes, I agree with Dr. Moore. So the convenience is really important. I'm the only medical person in my family, and something that everyone says is, you know, especially with COVID, we could go to the pharmacy to get it done. And that was so convenient because, you know, there was parking, you didn't need to make an appointment, you could just walk in, all of these things that make it so much easier. And while we're having these wider discussions, I was thinking, not just faith settings, but maybe, you know, when there's sort of the Diwali festival or Mellas that we have in Croydon, and, you know, because it is the younger population that we're trying to target. So maybe events where they might be at. So kind of really thinking about where might be a good place to start.
Great. Thank you very much, Dr. Hana Patel. And Gill, you've got your hand up.
Yeah. And I also think it's really important to know that, you know, information, when it came out at the time, and parents made decisions that based on the information they had at the time, some of those babies then are now adults who can maybe make that decision now themselves with that, make an informed choice. So there's different targeted approaches. And I also think that when we had COVID vaccination concerns, we hosted a COVID vaccination line where people could ring up and just talk, gone through further detail, because actually sometimes if you just make an appointment with your practice nurse, you might feel that actually that's a done deal. You go in there, you're having your appointment, you've got to have it. So I think if there's a desire to host a dedicated call centre again a little bit, just to say, well, actually, can we just talk at length a bit more about this? I think that's something that we can facilitate as well. I think we should be open to addressing all the needs and concerns of the children, of the what were babies then, who are now adults now, and also the parents. You know, they might want to work with their children and say, well, actually, this was the information we had at the time. Yeah, fully support you in doing that, because they may be thinking, well, actually, do I go against what my parents made? You know, it is a little bit more complicated, isn't it? Because we're in this position because so many people haven't been vaccinated. So we've got to sort of try and help everybody work together to make this decision.
Absolutely, and that, you know, I just had a thought prompted from a conversation I'd had with Mikhaila actually yesterday around people knowing whether they've had the vaccination or not, and vaccine records that don't necessarily go back. If you've if you've, you know, migrated, or you've had change of GP for various reasons, you might not fully know, and you know, sometimes we forget what we've had as kids. So what happens in that instance? Mikhaila, I wonder if you can answer that. You're on mute, I think. Right, I'm going to try and unmute you. Did it send a request?
Perfect. It's happened. How many years have we been on Zoom and we're finally figuring out mute? Yes, of course. So when we think about vaccination status, there's oftentimes the GP will have your history of your vaccination status in most cases. If there's no vaccination status, we assume that there is no vaccine history, and we would start the MMR vaccine again. If you've already had it, it's not a problem to start that. So you'd have your 1 dose and then the 2nd dose. If for immigration, for example, you may not have any of your vaccine history. So again, it would be the same. We would recommend for you to register with a local GP practice and to have those conversations about their immunisation history, and to start any missed vaccines that will get them up to date.
Fantastic. Thank you very much. Now, I'm conscious of the time, and I know, Dr. Hana Patel, you've put your hand up, so I'll take your point on this, and then we'll try and answer some questions that have been posted in the chat.
Sorry, I was just going to share that I had to go and get a vaccine recently with my children, and we went to the local pharmacist, and he was able to look at my summary care records, and he told me about vaccines I didn't even know I had. So, you know, the pharmacist is a fount of knowledge. So if you're ever stuck, you could always ask your pharmacist too.
Fantastic. Brilliant. We've got a couple of questions that have come in. A really interesting one, and I don't know if we touched very slightly on that already, Dr. Moore. So it says, are the reasons of not having the vaccine different in different communities? Are there any studies that show the reasons?
I'll keep it brief and say yes. I think the reasons definitely do vary from community to community, and that may be communities based around culture, around religion, around ethnic origin, geographies in the world. We've spoken about certainly very low rates. And similarly, it might also be down to deprivation. We know those people who are the most deprived in Croydon are the least likely to get MMR, which will change. Different factors take place for those people. Some it will be as a result of systemic racism over the years. Some terrible things used to happen in America. I think the well-known syphilis study has particularly caused issues among some communities at the time. And every different cultures will have different reasons. And I think one of the difficulties in immunisation and vaccination is there is no one size fits all. And actually it comes down to having the time and being able to have those conversations and discuss what the individual concerns are, because everyone has their individual concerns. And I think one of the other comments in the chat has raised that actually. It's about having that time available to have those conversations. And certainly one of the things public health are doing is we're looking at how we can engage and how we can ensure that there's time for that in the services that we're commissioning and trying to provide in Croydon.
Thanks very much, Dr. Moore, does anybody else want to come in to that question before I move on? No? Okay. So another question we've got in the chat is a lot of pregnant women that a colleague has spoken to said that they need more accessibility of information and need to have more medical professionals available to answer questions when they have doubts, as most of them feel scared and not reassured. Looking at information and speaking to someone is a very different experience. What are your views on that, and are you finding that in the people that you speak to, that the confidence isn't there when it comes to the information that's available, and it's a different experience, isn't it, when you're actually talking to someone? Anybody want to make a comment around that?
I mean, Emma, if I can just say, it goes back to what I was just saying. I think if you've got access to what you call a safe space with people who can maybe answer the concerns that you might have, because it could be a cultural, belief that for various reasons. So if you could have information presented to you in a way that you can ask back, have those open conversations before you actually turn up at the GP practice, or we come and support making the vaccination more available. But I do think it really worked well in COVID, where clinicians would be able to ask those questions, answer those questions. So I think that's something we could consider.
And this question, it looks like it was really around pregnant women. Do midwives have training around vaccination information? Where can pregnant women go to have that chat?
It's a good point, isn't it? I mean, I would have thought they would have access to that, but that's something that we can take away. But again, if it is specifically around a particular vaccination, then all the frequently asked questions that we should be able to ask would cover examples like this.
And just to come in there as well, one of the other professions is, of course, your health visitor. Quite often you'll have contact with them following the birth of your child, and actually they will have some of that time to be able to have that conversation about vaccine prevention as well, and answering questions that you might want.
Okay, so I'm not sure if it's a question or apologies. I don't know if it's a question or a comment. We'll find out when I read it. Somebody's said giving education around the vaccination, how the vaccination works, and possible side effects from receiving the vaccination. This enables the parent to be prepared for the symptoms. However, also emphasize on the impact it has on the children that would not have been vaccinated. That way, at least the parents will be able to make more informed decisions. Is that not happening, Hannah? Is that currently not the practice, where parents are informed about the possible side effects, or in preparation given enough preparatory information to go and have the vaccination? How is it done in schools? I wonder, do they inform people about the MMR vaccine and what happens? Can anyone enlighten us?
Sorry, Emma, not for me. I'm not aware of the school programme.
Dr. Hana Patel.
So again, from having little people at home, we normally get letters sent home to say, would you like your child to have, for example, the flu? Would you like your child to have the flu vaccine? So there's information sent out. But I think when I see patients who give the feedback that's just been given about not enough information being given out, I think you do tend to just go to an appointment. The nurse will, because it's normally the nurse that will give the vaccine, will normally say a little bit about the vaccine is, and there's tips that they give you that it would have been nice to know before, but that information isn't always given to the parent before. So maybe there is something around that to improve that information giving. So there's the opportunity to ask questions and be reassured.
Fantastic. Thank you very much. And of course, Mamoon's going to give us all of the solutions because his hand has gone up. So Mamoon, over to you.
No, Dr. Hana just mentioned about the flu. So I just wanted to ask, basically, what's the current uptake for the flu and the COVID vaccination? Does anyone have that information?
You might need to repeat that question. I mean, I'm not sure that I heard it
Oh,
properly.
sorry. Can you hear me? Hello? Okay. No, I was just going to ask, what's the current update for the uptake for the flu and the COVID vaccination?
Dr. James, do you know, Mikhaila? Anyone know what the current?
I'm afraid I don't have the current data for flu, but Christina's got a hand. So
If you give me a few minutes, I can fetch it for you. Bear with me.
No problem at all. We'll just continue talking. I mean, well, actually, we're very close to the end, and this is amazing because we've actually managed to finish a webinar on time. I know, Dr. Hannah, your hand's gone up. That might buy the crucial time that Christina needs to find the information for us.
So it was just to say, I found old data on NHS England. So last year, at the end of last year, 2023, with regards to the COVID vaccine, for people over 65, just over 60% of people had taken it. I don't have kind of local data. And then I just remember there was another point that was made about specific vaccines in pregnancy. There is, of course, the whooping cough vaccine that's offered to all pregnant women. So just, Jill, that question that you said, if it's specific vaccines, so that is specifically offered to pregnant women. That was all I was going to say.
Thank you, Dr. Hannah. And Christina, do you have an answer for us, or can we perhaps post it later? You have. You're nodding.
Do. Can you hear me?
Yes.
Alrighty. Okay, let's have a quick look at COVID. So as of January 24, the COVID uptake was at 39%, I believe. And for flu, let's have a quick look. It was 35% for Croydon.
Thank you very much. And that's the beauty of having experts together, because you can get real-time information on, directly answers to your questions. And ladies and gentlemen, we've come to the end of our webinar. We do like to let people go at the right time to respect the fact that they've actually joined the call. And the success of a session is usually how many people are left at the end. Congratulations, because we've pretty much kept everyone right till the end. And I'm pretty sure community members who've logged on will agree that it's been a really interesting and informative conversation. My thanks to our funders for funding this conversation. My thanks to our panelists for joining us, and my thanks to the community for listening in. We will continue the work that we do in the community. You can find out more if you visit our website, which is www.arccltd.com, or you can follow us on, there you go, we've finally got the sofa style. That should have happened a little bit earlier, actually, when we were having the conversation.
That is great.
Or you can join us on socials.
Some people to stay on.
We're at ARCC Ltd, and that's it for today. I hope you have a fantastic rest of the day and a great weekend to come. Thanks everyone for joining. Bye now.
Thank you for hosting. Thank you for having us, everybody. Bye.